Good morning, ladies and gentlemen. How are you guys today? You good? Had your coffee? My name is Linda Williams, as Dr. Dixon said, and on behalf of the directors of JAHJAH Foundation and in association with SIRA, the Southeast Regional Association Hospital, I'd like to welcome you all this morning, the speakers, the attendees, and the volunteers. The Ultrasound Conference represents it's the first event of a series of events of the JAHJAH Foundation. It's a signature event. It's been going on now for about 8 years. Dr. Dixon likes to remind me that it started in my home. With age, the memory kind of goes. He tells me this, so I just have to believe him. So Dr. Dixon used to come down to Jamaica all the time, stay with me, and on one of his trips he said he wanted to visit KPH. For someone coming down from North America to go to KPH is not exactly it's not a pretty area. It's not a tourist area. So when he said he wanted to go down to KPH, I said, okay, sure, no problem, I'll take you. Just be prepared. So from there, I guess this whole foundation, that's where it started. And I'm proud to be part of this movement, this organization, this foundation. So this event, the Ultrasound Workshop, it's a kickoff of a start of a week of events that's called the JAHJAH Foundation Mission for Change 2015. The series event includes the Healing in the Dance Hall, which is later on tonight, the Hamburg Home Mission, which is we're going to be dedicating a sick day to the Hamburg Home, as well as spend a day with the kids. And these are kids who are homeless and abandoned. The Pediatric Cancer Fund Conference, which is to be held at this venue on Wednesday. A free health clinic for the residents of Alta Spring, Trolley, and a free echocardiogram testing for Jamaican high school athletes. And the donation of medical equipment, furniture, and supplies to KPH and all the hospitals. So nothing's happening.
Okay, so what are we talking about? Free fluid, okay? This is left upper quadrant ultrasound, and this is free fluid. Here's a diaphragm, here's a kidney, and here's a spleen. And this is something you don't want to miss, okay? This is a large amount of free fluid that's in the abdomen. And this is someone who probably should have been in the OR maybe 2 hours earlier, if you had that much time, or maybe however early. This patient has a lot of free fluid in the abdomen. Here's another free fluid in the abdomen. And here is another right upper quadrant, Marston's pouch, kidney, liver, free fluid in the abdomen, okay? You don't want to miss this.
To start off with, talk a little bit about the gallbladder. We all know about what gallbladder does. It stores bile, right? Whenever it stores bile, what does the bile do? The bile is then secreted into the duodenum. It helps us emulsify the fat. Looking at the structures surrounding the gallbladder, which is right there, we have the portal vein system, which brings in nutrients all the way from the small intestines and it brings into the liver. And then we have the hepatic duct system, which connects with the cystic duct system, which joins to form the common bile ducts, and then it joins the bile into the duodenum. And then after that, we have the hepatic veins, which collect and then form the IVC and transfers all the venous blood to the heart.
I just want to say, the first lecture was probably a little daunting because Dixon showed a lot of different stuff, and really the idea of that was just to familiarize yourselves with the multiple different applications of ultrasound.
So this is a live video where we have basically the uterus, we have gestational sac, fluid, and then we have the fetus here, fetal pole, and you can see a little bit of the umbilical cord here. That's a yolk sac down here. So yolk sac's a nice little round structure, and the fetus is here. If we could scan a little slower, you'd be able to see that's your yolk sac. If you scan a little slower, you would probably be able to see fetal heart rate right around here. And that's kind of what we'd be hoping for.
Okay, morning. I'm Dr. Simone French. I am an emergency medicine consultant at the University Hospital of the West Indies, which is a teaching hospital in Jamaica. and I'm also a qualified sonographer. I attended the course today and brought some of my residents with me so that they can experience what the course has to offer. Having attended several such courses, I think this course is certainly on par with anything that is on offer anywhere in the world. And so I'm happy to have been able to bring my residents because I think they will get a lot from the course that they can go back to the hospital and apply to the benefit of themselves and their patients.
Good morning. I'm Dr. Tamika Henry, and I'm from the St. Anne's Bay Hospital here at the Emergency Ultrasound Conference. Hi, everybody. I'm Dr. Tamara Henry, and I'm here with my sister and others in Jamaica benefiting greatly from this JAHJAH Foundation ultrasound course. Well, I think the course is extremely beneficial, particularly in the rural areas. We don't have the facility to just run up and get people to come down, so we are getting hands-on training that can help us to move the patients faster to the emergency room, not to let them sit and wait for an ultrasonographer to come. But if we're trained, we can just go ahead, do what we can do, and so we can move the patients off so they can get treatment. All right, so how important is the ultrasound conference for us in Jamaica? It's very important, particularly, as she said, with regard to the rural areas where we don't have the access to CT scans and all of those things. We don't have many surgeons on board sometimes. And there are persons who come in, we get a lot of trauma. Sometimes we don't know what to do with them, if we're supposed to call the surgeon to come in right away or if we're supposed to move them to the operating room right away. But with this ultrasound course, it will be very beneficial to us. When you get our trauma patients, especially those with abdominal trauma, we can do our fast ultrasounds, or even chest trauma. We can do fast ultrasound to see if there's any free fluid, and then we can be able to dispose of the patients adequately and in a very, very timely manner.
Yeah, hello. My name is Dr. Pugh here. I'm working at Mapen Hospital. This course is really beneficial because in our settings, the radiologists, the dependence on the radiologists, it's too much, right? In an emergency room, we always see these traumatic patients and emergency thing who needs an ultrasound. It helps with this to decide whether the patient needs to be referred urgent to go to OR, those kind of things. I think everybody needs this course. The place is nice, the settings is all right, and the teachers are really good. So everybody should attend these courses, and it's really beneficial.
I'm Hugh Wong, consultant in the emergency room at KPH. We'd like to talk a little bit about this ultrasound course that we're having at the Knutsford Court Hotel, put on by JAHJAH Foundation, Trevor Dixon and his team. This is our 8th year, and we have a full house today. The training we have and what we're doing will provide a basis for our doctors, particularly in our emergency rooms, to become more skilled in using ultrasound as a diagnostic tool in the emergency room. It saves lives by cutting down on time for diagnostics. For patients who are too unstable to go for CT scans, we can always use ultrasound to have a look basically into the abdomen to see if there's any free fluid or any pathology that we should be aware of. This will shorten the time for surgery if necessary, or will defer surgery if the findings suggest that surgery can be deferred. We try to train young doctors from all of our hospitals in the public sector and also UA, because we realize that training should not be for a select few, because we do not know where ourselves will become ill. We can become ill anywhere in the island, and we expect all our physicians to become skilled. Trevor has been doing this for 8 years, and we thank him for his support and the difficulties that he goes through every year to put on this course. And we really thank him and JAHJAH Foundation. It is really a great sacrifice on his part to come down with his team, to get his residents here, to pay costs for accommodation and so on, to provide basically a free service to the physicians of Jamaica.
So, this being an abdominal probe, immediately we see good things. Notice I'm placing fairly hard, and
show
I apologize if
the
I'm doing
uterus
it all.
and its contents.
So what we're going to
If
see
you
right
don't see
here is,
this,
of course, the first thing you notice is
something is
anteriorly.
probably wrong,
When
okay?
when
is
you're
longitudinal.
ultrasounding,
You go
you want
transverse, you're
to
trying to
view it,
go
you know,
90 degrees.
think about it at
So
least
up and up,
pictorially and how
go
it's going to
down,
see on the
go
screen.
all the
So
way down.
that's what I do is
That's the cervix, come
basically
back
the
up.
fans of the probe are going
Focus the
exactly like
uterus.
this, in this direction. And that's kind of what's depicted here. So
Go
it's
down.
really kind of close together here, and as it fans out, your ability to see things is a little bit less and less and less. And so what we're seeing here is basically anteriorly, this is the subcutaneous tissue, you know, the entrance into the peritoneal cavity and the peritoneal fascia, and then almost I'm squishing everything down except for the first thing, which is all the structures that we want to see here. This is posteriorly, this is the vertebral body, and this is the aorta and the IVC. My technique is that I always have this is like my connection with the patient. It's not the actual probe. So I may be pressing down with the probe, but what I always have is my hand out like this, and so it prevents me from slipping around. So if you just do the probe, you're going to be looking at stuff, and your view is always going to be changing because you can't stay static if you choke up on the probe. So the most important thing is you kind of hold it down like this, whatever's comfortable with you. But I use the entire, ulnar surface of the hand to contact the patient first, and then I put my probe down, so that's really what's how much I move is all on me, and it's not at all about the jelly and the probe. So that's a really important thing to get your stability down and to really kind of fine tune your movements.
Okay, so hold it lower down like this. You gotta tilt your hand down. Make sure you see the belly. You want to see all three things. Okay, you start. Go. That's what you want to see. Vaginal canal, bladder, uterus. You want to see all three things in one picture. Not this. Not beautiful picture of the baby here. You can't see anything else, right? But it could be up against your abdominal wall. I've seen that, you know? You want to make sure this is what you want to see, okay?
So when we talk about like OB ultrasound, everyone likes to see the bladder on the right and the uterus on the left. So if your image is flipped around, you see the bladder on the left side, that means your probe isn't on the right way.
So you can just flip your probe
So
around.
just flip the probe around, you'll get the right image. So people, the orientation is always very, very important when we talk about like our colleagues who are going to be really looking at these images with us. For our purposes, obviously we see the same thing, but it's for that. So when we talk about cardiac, when we do the cardiac ultrasound, again, which side the ventricle is on, which side the atria is on, all that matters when we talk about our colleagues. But for us, we practice with them as well, so that way we do the images the same way they want it. Right.
Okay.